Well, that's fancy. I gave myself a notification that I'm going live. Very interesting. I guess I did turn those notifications on. If you guys haven't yet turned on the notifications and you do want to know every time I'm live, maybe you're interested in being part of the live sessions rather than watching it later on, definitely make sure you hit that notification bell right next to where the subscribe button is, so that as soon as I go live, you will all get a quick notification on your phone and on your desktop to let you know that I'm streaming right now. Let's see. So far we have finished Picorna, we finished Calisi, Flavi. We also talked about Togovirus and how that's Rubeola, which is German measles. We did the coronavirus, our first helical guy. So now we're down to the rest of the big negative strand RNA viruses. So let's just dive right into, let's see, we talked about this. Okay, rotavirus, right? So we haven't talked about rotavirus. This is actually the last positive RNA we haven't talked about. Rotavirus is one of the two guys. There's cultivirus and rotavirus. They're both reoviruses, right? And reovirus is repeatovirus. So remember, all RNA viruses are single-stranded except reovirus. Reovirus is the only double-stranded double-stranded RNA, positive RNA virus, and really the only double-stranded RNA virus, period. Right? All the other RNA viruses are single-stranded, so repeatovirus or reovirus. This contains rotavirus, which is the #1 cause of diarrhea in children. It can actually cause fatal diarrhea, so they can die. And cultivirus. Cultivirus is also known as Colorado tick fever. That's what it's going to cause. So first thing we see right here, we have our rotavirus guy with this image A. It's also one of the first segmented RNA viruses we're going to be talking about. Right, so BOAR, B-O-A-R, is the mnemonic for all the segmenting guys. And that's right here. You bunyavirus, orthomyxovirus, arenavirus, and reovirus. Right, where reovirus, 10 to 12 segments. It has the most segments. Bunyavirus has 3, influenza has 8, and arenavirus has 2. And that's going to be pretty clear when we do those images. This is actually the image down here for reoviruses. So let's just read this about rotavirus first. It says it's a segmented double-stranded RNA virus, most important global cause of infantile gastroenteritis, major cause of acute diarrhea in the United States during winter, especially in daycare centers and kindergartens. Villus destruction with atrophy leads to decreased absorption of sodium and loss of potassium. Right, so sodium and potassium are both going to be low. CDC recommends routine vaccination of all infants except those with a history of intussusception or SCID, right? Because they don't have a strong immune system anyway. So the rotavirus vaccine is somehow known to cause intussusception, which is sort of scary, right? Because intussusception is pretty painful, it's problematic, and it starts from a lead point, which just then leads to parts of your intestine going into each other and a telescoping thing happening. So it's a really weird thing, but it is somehow related to the rotavirus. No one really knows the exact mechanism through which rotavirus vaccination and intussusception are related to each other. So right here we have our rotavirus picture from Sketchy Micro. So let's take a look. Fit this right there. Okay. So reovirus, a race on the Rio, right? And this image is actually happening. It's the Rio Grande Prix, right? It's a race, the Rio Grande Prix, or Rio Grande Prix. So there's a race happening. Everyone's on boats. They're all racing, and this is all going to show you everything that has to do with the reoviruses, specifically rotavirus and Colorado tick. Right. So that's right here, the cultivirus. So a race on the Rio. This virus is a double-stranded RNA, so it's neither negative nor positive. Hence, there is no sun or moon. Right. This is the only RNA virus picture with no sun or moon. It's just it's either sunset or dawn. It replicates in the cytoplasm, though, which is also a unique thing. Right? It replicates in the cytoplasm. It is naked, so you see the rock statue of David on the left. Reovirus is the last virus of Bohr, right? Our segmented guys. Bunyavirus is going to have 3 chopped trees. Orthomyxovirus is going to have an 8-legged octopus. Also, the word ortho ortho anything in mathematics, it usually means a parallel thing. So you can remember, parallel, and you could try to work out somehow the 8 aspect of it. But this is going to have an octopus with 8 legs, so it's the easiest thing. And arenavirus has 2 circles for 2 people that are fighting in an arena in that image. So you'll know the segments here. In Riovirus, with 11 segments, there are 11 boats in this Rio Grande River, 1 for each segment. So there's actually 11 boats racing. Being a race, there is a flotation rope that is a double helix to remind you that this is double-stranded RNA. The most important reovirus is rotavirus, which is transmitted by the fecal-oral route and causes a toxin-mediated secretory diarrhea that can be fairly explosive and watery. The rotary propeller at the bottom left depicts explosive diarrhea, right? And this propeller is what they're talking about right here. So this guy is revving up the propeller and he's trying to make his boat go faster. He's actually the only one that has a propeller on his boat. The other people are all like rowing their boats, right? So maybe he's not one of the racers. Maybe he's like a judge or something, or one of the referees or something like that. But he's the only one that has a propeller. And this propeller thing also happened in another image earlier when we were doing calicivirus, right over here, right? Calicivirus, you always remember the ship with the 3 dragons for Khaleesi from Game of Thrones. Calicivirus was another one that causes diarrhea, right? Calicivirus has the sunny day, so it's a positive RNA virus that causes diarrhea, but this diarrhea is not fatal. It's actually going to be self-resolving diarrhea that's going to occur on cruises and stuff like that, right? Cruises, whereas rotavirus is going to mostly affect like infants, newborns, but it can also work at daycare centers and kindergartens, so very, very, very young kids. So the overlap between rotavirus and calicivirus is pretty prominent because both do affect kids, but in completely different scenarios. From my experience, I believe I've only really seen calicivirus being part of a question regarding a cruise. So, if it's not a cruise, it's more than likely rotavirus, but you have to see if they give you any characteristics. Like if they mention the cytoplasm or if they mention double-stranded RNA, then you know it's rotavirus. Alright, so double-stranded RNA, the most important reovirus is rotavirus, transmitted fecal-orally, secretory diarrhea, rotary propeller. The toxin responsible is called NSP4, and it increases chloride permeability, illustrated by the 9-speed 4-stroke, and that's kind of what it says. Where is it? Yeah, on his motor. On his motor in yellow text, it says 9-speed 4-stroke, where, you might not really remember that, but now that you've seen the NSP4 being mentioned, if you do get a question on it and it's one of the answer choices, you'll be able to catch that. The boat itself is called the Chlorider, right? So like it's a play off of Flo Rida, the rapper. So Chlorider. Chlorider to remind you that, there's more chloride that is going to be, where did I just say it right here? Chloride permeability, right? More chloride entering. Remember this, so in Sketchy Micro, we're talking about chloride, but in first aid itself, we mentioned there's a loss of sodium and potassium, right? So low sodium, low potassium, and more chloride inside the cell, chloride permeability. The classic time of year for rotavirus outbreaks is winter, hence the snow caps on the mountains in the back, right? So you could tell there's a lot of snow in all these mountains, so it's definitely not summer. It's a snowy area. The boat people are kids because they are at risk, especially at daycares. In fact, it's the #1 cause of diarrhea in children, depicted by the guy with the red #1 glove right here. That glove is for #1. You often see people wearing this at like baseball games and stuff, right? So the #1 cause of diarrhea in children, right? So you really want to pick rotavirus as your answer for diarrhea if it's a viral infection and involves a kid. Unless it's a cruise, then you want to go with calicivirus. The other virus is known as Colorado tick virus, and it causes fever, vomiting, myalgia, but no rashes. This is what makes it different from other guys like Rocky Mountain State infections, such as Rocky Mountain Spotted Fever, because that actually has a rash, right? Rocky Mountain Spotted Fever has rashes to it. The sign "Welcome to Colorado" tells us about the Colorado tick virus. The kid below the sign is displaying the symptoms. This guy right here. Right? Treatment is supportive care and oral rehydration therapy, hence the blue water bottle. And what he's doing in this image right here is he's just vomiting a lot, and he's like really just, sweaty and stuff because he has crazy fever. right? So fever, vomiting, and myalgia, but no rash. A live oral vaccine is part of the standard vaccination schedule depicted by the live camera show. Right? So this is a live recording or live streaming of the race as it's happening. The guy is holding a mic syringe to his mouth because it's an oral vaccine. So this guy, his mic is actually a syringe in this image. That's right there. The first dose of rotavirus should be given before 3 months of age due to decreased efficacy and increased risk of interception due to the stimulation and enlargement of Peyer's patches, which then creates a leading point, and then that leads to the telescoping of the intestine inside itself. And that's depicted by the guy holding a telescope, right, which is this guy right here. He's using a telescope to keep an eye on everybody in the race. Right, this blue water bottle was also mentioned earlier in Sketchy Micro. And that's just to depict any time you need water, that's going to be there. So just rehydration is all you really do for them. But if you don't take care of it, then it does cause fatal diarrhea. So rotavirus is pretty scary when it comes to the RNA viruses. Alright, so we're done with that page. The next guy is influenza virus. And influenza is a really big deal, right? Because we have to deal with this every season, not every year, but every season. Right? Influenza virus is an orthomyxovirus, enveloped negative single-stranded RNA virus with 8 segments. Contains hemagglutinin, which is HA, and that binds sialic acid and promotes viral entry. Right, so hemagglutinin for viral entry. And NA, neuraminidase, this promotes progeny virion release. Right, so HA for entering, and then NA for making more progeny. Patients at risk for fatal bacterial superinfection, most commonly patients that get influenza, they're at risk of having fatal bacterial superinfection, and it's usually going to be S. aureus. It can also be S. pneumoniae or H. influenzae. And if they really feel like being rude, they'll give you a question about a patient who has the flu from influenza, but then has a superinfection from H. influenzae. And the only real way you'll be able to catch H. influenzae is to see if you see any epiglottitis, right? Because that's one of the unique things that Haemophilus influenzae causes. Reformulated vaccine, known as the flu shot, contains viral strains most likely to appear during the flu season due to the virus's rapid genetic change. And the flu season is a concept that a lot of patients don't really tend to understand, right? You can have 2 flu seasons in the same year. There could be a flu season that carried on from the previous year, so maybe it started December, went on to like mid-January, and then another flu season that starts in the coming November. Right? So at the beginning, at the end of every year, you have a brand new flu season. So it is possible to get 2 flu vaccinations every other year. Right? So something like that can happen. The killed viral vaccine is most frequently used. Live attenuated vaccine contains temperature-sensitive mutant that replicates in the nose but not in the lung, and is actually administered intranasally. Right? So 2 different kinds of vaccines for influenza. Now, this is the picture over here for influenza, and that's your octopus right there with the 8 legs to remind you. That is got 8 segments to it. Now, right here I have a little note I want to read. Do not answer a question based on the word endemic, epidemic, or pandemic, but rather by the amount of people affected. Endemic affects a small restricted area. Epidemic affects a community, and pandemics affect the entire country. Right, but if the question doesn't describe that an entire country is being affected, or if it doesn't describe a small area with like maybe one little town is being affected, then you don't know what's happening. Right, so that's one thing I want to point out, because these things are pretty important for genetic shift versus genetic drift. Right, a genetic or antigenic shift causes pandemics, so that's clearly a much bigger deal. Right, genetic shift. Pandemics, reassortment of viral genome segments, such as when segments of human flu A virus reassort with swine flu A virus. This is going to cause a really big issue in the whole country. Genetic drift causes epidemics, and this is a little more common for it to occur. Right? It causes epidemics, so in a small area, everyone's going to get the flu. Minor changes based on random mutation in hemagglutinin or neuraminidase genes. And you already know this is obviously much more likely to occur. It's also possible for both things to occur, but if there is a genetic shift, then the bigger deal is that the genetic shift occurred, not the fact that a genetic drift might have also occurred. And that is really going to be something you'll have to figure out based off of how many people are affected in the question you're looking at. But I have seen questions where they said, oh, it caused the pandemic, but the answer was genetic drift. Like, they called it a pandemic, but in the question they also talked about like how not many people were being affected. It was just a small little town. Pandemic is a very, I guess, subjective term, whereas a qualitative term, or a quantitative term, actually, a quantitative term where they actually tell you how many people in a certain population got infected, is much more reliable. So you definitely want to work off of that if possible. Genetic shift can occur in all the Bohr-segmented viruses, all four of them, Bunya virus, Orthomyxo, Arena, and Rio. They can all have genetic shifts, but for us, we're really only concerned if there's a genetic shift when it comes to influenza virus. Okay, so let's take a look at this sketchy micro picture right here. And it's going to have a lot happening because this is actually a really big deal, influenza. Oh yeah, wow, I haven't even made the text big yet. Okay, so let's see what's happening here. Okay, so orthomyxovirus, the night shift at the orthodontist, right? Orthodontist. This is the influenza virus, one of the most important negative RNA viruses. It is nighttime outside, and there are warm orange hues, so this tells us it's a negative RNA virus, right? You have your moon with the minus cloud in front of it. All negative RNA bring their own RNA polymerase, since they cannot use the host machinery like positive RNA viruses can, right? So you have to remember that. All RNA viruses replicate in the cytoplasm except this virus, Orthomyxovirus. Orthomyxovirus is the only RNA virus that replicates in the nucleus, right? So it's a very unique virus in that aspect. Orthomyxovirus is enveloped, depicted by the doctor's white coat. There are several viruses in its family, but influenza is most important. The poster on the right about fluoride has A, B, and C written because there are 3 different influenza. Right? So this one right here, fluoride A, B, C. So there is an influenza A, influenza B, influenza C. You don't really necessarily need to know all that. So is there a range of people being affected between endemic and the others? Let me put the NBME 23 review. I'm not sure when I'll do the NBME 23 review yet. I have finished the document with all the explanations to the questions, but I haven't really gotten around to having time to do it. And then when I do stream, I'm just really focusing on finishing up first aid. But I think I might go ahead and do a separate thing on Monday and try to post that. And as for endemic versus pandemic, there isn't exactly a range of people as per a range of population, right? So an endemic will affect everyone in one little population, whereas a pandemic will affect multiple populations, right? So that's the real difference between endemic and pandemic. I mean, there's many differences, but I like the way to look at it in terms of populations. So if you're looking at one population being affected, so maybe everyone in like a small town, like everyone in Queens, New York is being affected, that's sort of an endemic right there. Whereas that's sorry, not endemic, what am I saying? It's an epidemic right there, right? So if everyone in Queens, New York got affected, that's an epidemic. But if everyone in all of New York State got affected, that would qualify as a pandemic, because that would involve multiple populations within the state of New York. So that's one way to look at it right there. Let's scroll down again. Why? Okay. Let's stay up here. Alright, so orthomyxovirus is the only virus that replicates in the nucleus, and that's definitely a very important fact to remember right there. The aquarium in front has an octopus with her babies inside the helmet, because they replicate inside the nucleus. The octopus is used to depict that this virus has 8 segments. The O of Bohr. Orthomyxoviruses are the O of the Bohr for all the segmented viruses. There are 2 types of mutations that cause variation: antigenic shift and antigenic drift. The blackboard on the left explains the 2 mutations. Drift has point mutations, leading to the changes in hemagglutinin or neuraminidase molecules. This is shown by the Dr. Drift. Right? You can see Dr. Drift is misspelled because there's a point mutation where C became K. So that's Dr. Drift right there. Genetic drift is just tiny mutations in one of the HA or NA proteins. Shift is a much more serious thing, but rarer because mutations are easier and more common to occur, right? So shifts are more serious. These occur when antigenic segments of RNA are shared between species to combine and make new surface antigens. This is shown by the night shift, where the extra N and H at the bottom are going to swap with available N and H and cause new variations. So what's happening is this N and this H, they're about to fall from up here, and then a new N and H are going to come up here, and that's a shift. That means that you're combining with a whole different population of influenza virus, maybe from swine flu or whatever, and that's going to cause a really, really big change in the virus itself, so that's problematic. Alright, so Dr. Drift is just a point mutation, and that's really easy to remember. That reminds you that it's just mutations in drift. And mutations are easy, so drift is more common, but it's a relatively smaller deal than a shift. Shift is going to be a big deal. These variations are depicted by the multicolored curtains. Influenza, the multicolored curtains again. Multicolored canopies, multicolored curtains, anything like that that happens usually is about many mutations or changes, right? Influenza A is the most important of the three since it causes epidemics and pandemics due to shift and drift, while B causes endemic outbreaks only via drifts. Right, so it's a really unique thing. You don't really get tested on B and C and all that specifically. You'll just get questions on influenza for the most part. Note that the octopus is sitting on red blood cell stones that symbolize hemagglutinin. Right, so hemagglutinin is right there, further denoted by the name of the aquarium, which down here says heme aquarium, so hemagglutinin. HA. It causes red blood cells to clump like the stones in the aquarium. There are H1, H2, and H3 strains, so some strains affect only humans, while others affect other species. Hence, HA defines the tropism of the virus, whether or not it affects humans or not. So if you and yourself have influenza that doesn't affect humans, and you're a human, obviously, it's not going to do anything to you, so thereby meaning it has no tropism in you. Alright, so if you get a question on what defines the tropism of influenza virus, it's that hemagglutinin protein. HA binds sialic acid on the cell membrane and is endocytosed. Antibodies to HA prevent reinfection by a similar strain by blocking its binding to host cells. The pH has to be perfect for viral uncoating, and pH balance is accomplished by the M2 protein, which is a proton pump. Alright, so pH is a really big deal, and that's pretty significant anytime you ever have an aquarium. Alright, so if you've never had an aquarium, you might not know this, but if you ever get an aquarium, you have to make sure not only is the temperature inside the aquarium perfect, but the pH of the aquarium has to be perfect too. So when you see an aquarium, that should ring a bell now, because if the pH is off, the fish in there can die. Right? They can actually get sick or get infection and then just die. The pH has to be perfect for viral encoding. pH is balanced by M2, a proton pump. The M2 protein is depicted by the shell on the right, and its top looks like two M's. Right, so this shell right here, you see how you have a yellow M, another yellow M, right? M2. The M2 protein, drugs like amantadine and rumantadine stop the M2 protein, right? So now you know what amantadine and rumantadine do, and the fact that they are good medications for people who have the flu. They stop the M2 protein depicted by the manta with eating utensils, right? So this manta is trying to dine, right? So it has a fork and a knife. So a manta is trying to dine, that's amantadine right there. So it actually works perfectly right there. Amantadine stops the M2 protein. That's what you're understanding from these two things in this corner. However, these drugs only work against influenza A because B does not have M2 protein. Amantadine is used for Parkinson's because it increases dopamine release by some unknown mechanism. Right? So in case you were wondering where have I heard this medication before, unrelated to microbiology, then that's where you heard it. Amantadine also helps with Parkinson's. Now, the virus babies need to be released, but they are bound to the host cell by sialic acid residues, right inside the nucleus. This is where Na comes into play because it cuts the sialic acid, depicted by the scalpel the octopus is using. Right, so this octopus is using a scalpel right there to cut this open so that all the little babies can come out. The scalpel is missing from the nurse assistant tray, which is right here. Nurse assistant tray has 3 scalpels. This one came from there as well. This is supposed to remind you of neuraminidase. Where are we? The scalp was missing. Okay, and her name is actually Tammy V. And that I never remember, but I always remember Tamiflu, which is a medication, and that's what they're trying to help you remember. So the nurse's name is Tammy V, and you're supposed to be able to see that on that badge she has when you do like a big video screen. This is a smaller picture. So Tamiflu is like the quick medication you give to every child that comes in during pediatrics, and you can tell that they have the flu. Just go ahead and get them Tamiflu ASAP. You can't really waste time. She is covering the scalpels to depict she is an NA inhibitor, right? So what she's actually doing is, you could tell over here, she's adding a little rubbery cover to the sharp end of the scalpel to make it not so sharp anymore, so people don't cut themselves by mistake. And that's a good way to depict a neuraminidase inhibitor. This prevents the baby viruses from being released, and they are ineffective after the baby viruses are released, which occurs within 72 hours. So that's why you have to hurry up and give them this medication, because if you wait too long, the baby viruses are going to be released now, and then giving a neuraminidase inhibitor won't really be significant. Transmission is by respiratory drops, depicted by the water drops coming from the aquarium. So there's tiny little water drops floating up here, one over there, a bunch over here, right? Water drops, because the fish or the octopus in there are all flailing around. Flu season is December to February, so a good time to give the flu vaccine is in October. There is a live attenuated vaccine given intranasal, depicted by the nose that looks, the rock that has a nose to it, this one right here, the nose rock. Right? The killed injectable version is depicted by the skeleton with the syringe, which is down here, this skeleton sitting here with the syringe. Right, so there's two different versions. The killed vaccine has two forms, and children can receive these vaccines after age 6 months. So October usually is the right month to give the flu vaccine, right? And this would be for the upcoming flu season that's going to go from December to February. But if you give somebody a flu vaccination in October, then of course the next flu vaccination they'll need will again be in October. So whoever keeps up with that, they're good to go. Some people don't get it October, November, December, January, and then like sometime mid to late January, they'll be like, I want to get the flu vaccine because I saw people getting the flu, right? So now they're scared all of a sudden. So they'll get their flu vaccine like early February, for example. Then again, in the same year, by October, their doctor is going to be like, oh, it's time for the new flu vaccine, and they'll be like, I already got the flu vaccine. They didn't. They got a flu vaccination in February for the previous season of flu. Now there's a brand new strain out, so they need to get it again. And that's something that you have to explain to your patients oftentimes, because they think that the flu vaccination is something you get once every 12 months. And that's not how it works. It's once every season, and a season can repeat within the same year. Typical questions will present a 70-year-old woman with myalgias, fever, and non-productive cough. She gets better, but then she has productive cough and fever and looks really sick in your office. She has pneumonia, a major complication of influenza, depicted by the lungs on the kid's bib. Right, so this one right here, he has lungs on it. The pneumonia is caused by Staph aureus superinfection, but it also could be strep pneumonia. There will also be a patient where the mother gives her child aspirin because of his flu, but this is a huge mistake because this leads to Ray's syndrome, right? You can't give aspirin to kids. This is depicted by the aspirin bottle with the skull on top, and the image shows a cow with a liver mark and a man with a turban, because Ray's syndrome gives encephalitis and liver failure, and it can be fatal. Aspirin also uncouples oxidative phosphorylation, which leads to extensive damage to hepatic cells. Don't forget that influenza is also associated with Guillain-Barré syndrome, ascending paralysis, with CSF findings of high protein and low white blood cells. Albumin-cytologic dissociation, that's exactly what this is. So albumin-cytologic dissociation is a little hard to say. It is just a way to describe CSF findings of high protein and low white blood cells. So that thereby being viral, basically. It's viral if protein is high. And this is shown by the same bear from Campylobacter video, right? So that Campylobacter bear is right there. Right? And this isn't really mentioned in the book, right? They don't mention it in the book, but influenza is related to Guillain-Barré as well. So that is something you have to keep in mind because it can pop up in a question. Right, so that right there was there. Aspirin is also a very common thing. Not every parent on earth really knows you can't give aspirin to kids. So if their child just gets really, really sick and feverish and, obviously has the flu, if they give aspirin to that child because they know aspirin helps them as adults, it should help the children too. Well, that's the wrong thinking there, because it's actually going to make the child much worse. All right, so that right there was influenza virus, your only orthomyxovirus that you need to know. We already talked about rubella, right? Your German measles from your what is this? Yeah, we read this one yesterday. Where's the picture for rubella? Oh yeah, right here, right, this guy. So we did rubella yesterday. Your German measles guy, as well as your other toga viruses, which include Western, Eastern, and Venezuelan equine encephalitis virus. Right, so rubella is a toga virus, and that's been taken care of. We haven't done rubeola, which where is it? Which is your normal just measles, right? And that's completely different. And the two bugs are very different as well, right? So if you go back up here, your toga virus is a positive RNA virus, whereas the other guy, measles, which is rubeola, is a paramyxovirus, and it's a negative RNA virus. So measles and German measles are very different from each other. But before we get to that, we have our paramyxoviruses right here. Right, so paramyxoviruses, well, this is it, paramyxoviruses. Paramyxoviruses includes a bunch of guys. It has your, let's read it. Paramyxoviruses cause disease in children. So once again, we're seeing kids being affected. They include those that cause parainfluenza, which is croup, mumps, measles, respiratory syncytial virus, and human metapneumovirus, which causes respiratory tract infections such as bronchiolitis and pneumonia in infants. All of these guys, all paramyxoviruses, contain F protein, which is the fusion protein, and that causes respiratory epithelial cells to fuse and form multinucleated giant cells. Palivizumab, a monoclonal antibody against F protein, prevents pneumonia caused by RSV infection in premature infants. Right, so this is a very specific case that you would get a question on. Right, so palivizumab for paramyxovirus prophylaxis in premature babies, preemies. Right, so that's one medication you have to remember, just directly related to palivizumab. And where are our right here. So paramyxovirus, this image. Let's take a look at what's happening with this. And this is a lot of viruses, right? So remember, paramyxoviruses right here. Paramyxoviruses, negative RNA virus, parainfluenza, RSV, measles, mumps. Right? RSV is the #1 cause of pneumonia and bronchiolitis in babies, especially premature babies who don't have everything they need to survive as well as a completely mature baby. Alright, so let's take a look at what's happening with this. A bunch of viruses in the same picture again. But it's a good picture. It actually does a very good job getting everything you need to remember to stick to you. So it's called the paranormal mixer, which helps you remember paramyxovirus. Right, so the paranormal mixer, these guys are negative RNA depicted by the orange hue and nighttime moon. The virus is enveloped, depicted by the ghosts covered in sheets carrying their invitation envelope. Right, so all three of these ghosts up here. And you can also remember the fact that everyone's wearing a costume, so it is envelope. They are all spread by respiratory droplets, as represented by the droplets from the sprinkler system. The puppet show on the left is the same puppet show that you saw in rubella video, right? So the same thing we had in rubella as well, for your live vaccination. It depicts the live vaccine for measles, right? But it's the MMR vaccine, so measles, mumps, and rubella. Being a live puppet show with 3 puppets tells us that it covers rubella, measles, and mumps. The place plotline has the evil vaccine puppet trying to vaccinate the pregnant woman, and it is contraindicated to give live vaccines to pregnant women. So that's kind of what's happening here. So you have your evil guy with the vaccine, the good guy trying to save the woman, and then this woman with her pregnant belly. The ghostly weasel on the left represents measles. So that's this guy right here. He represents measles very well too. He does a great job representing it. Measles, also known as rubeola. So the lady weasel has a ruby colored dress. Her name is Rubeola. So if you ever need to remember what name is for what, that's how you would do it. Right? Remembering German measles is rubella was easy, because that's that little kid who looks like a German emperor in that picture we did yesterday. Here we have measles. Measles with weasels, and you have this woman, female a weasel all dressed up. Her name is Rubeola. right? So that's how you're gonna go ahead and grasp that. It's not the easiest thing on earth, but you gotta figure it out. Just call her Rubeola and just stick to it, and you'll know this is measles and not German measles. German measles is that bratty little kid, and I guess you could say his mom's name might be Rubeola or something. Whatever works for you, you know. So this is Rubeola. Diagnosis is depicted by the 4 C's that form the buttons on the male weasel, right? So you see the 4 C's right there. Cough, coryza, conjunctivitis, and then Koplik spots, which actually starts with a K, right? Koplik spots. So the weasel has red eyes, a runny nose. Koplik spots are small bluish-white spots on the mucosa, right by the molars, inside the cheek. They are pathognomonic for measles and are depicted by the little blueberries that the weasel is eating. Right, so you can see the tiny blueberries right there. You're going to see little blueberry type rashes in the inner end of the cheek inside. That's what gives it away that this person has measles. A day or two after seeing Koplik spots, the patient will develop a pruritic maculopapular rash that starts behind the ears and travels down to the rest of the body, depicted by the rubies going down from the headband of the female weasel. Right, so this female weasel right here. Now, this post-auricular thing, we also saw this in rubella. So we have to make that comparison and figure out how do we know if a patient has rubella or rubeola, because both answer choices are going to be there. So is it German measles or normal measles? Well, pruritic maculopapular rash behind the ear travels down. Measles forms a confluent rash, and that's a very important deal. Confluent rash. So confluent rash meaning that the rash is all like stuck together, right? So the dots are very, very, very close to each other, compared to mumps. So the rash dots blends together. Not compared to mumps. What are mumps? Compared to rubella. Sorry. One complication is viral or bacterial pneumonia, represented by the weasel's untied, dangling bow tie that looks like lungs, right? So his really big bow tie, it actually looks like headphones, but that's his really big bow tie just dangling around his lungs. Another complication is subacute sclerosing panencephalitis. The subacute sclerosing panencephalitis is SSPE. The little boy has a turban on for encephalitis. So each one of these guys have their kids with them too. So the weasel's child right here is wearing a turban to remind you of encephalitis. A question will tell you that a patient had measles as a child or was never vaccinated, and then 5 to 15 years later, the patient has personality changes, seizures, myoclonus, ataxia, and eventually coma or death. So that's supposed to tell you that's SSPE, subacute sclerosing panencephalitis. Diagnosis will show anti-measles antibodies, and there is no treatment at this point. The Tales of Suspense reminds you of SSPE, and that's the name of the show, The Tales of Suspense. The lady weasel is reaching for tentacles, which is a symbol of the octopus from orthomyxovirus, and that reminds you of heme agglutinin, right? So that's what she's eating, tentacles. You can see the other guys also serving tentacles. So heme agglutinin is going to be a part of measles. It has the same antigen as well. The weasel child has sticky stuff on his hands to remind you of the F fusion protein, right? F makes something called syncytia. Syncytia are multinucleated giant cells, also called Warthin-Finkelday cells. In addition to the many nuclei, you'll notice eosinophilic intranuclear red inclusion bodies, which is also pathognomonic for measles. Vitamin A can reduce the risk of complications and mortality, so the main weasel has a party hat that looks like an A. So this is actually not an antigen or anything, but really a vitamin that you can give to people who have measles. The next thing we have in this image are your mumps mummy. Right, so the mumps mummy. So that's this guy and his kid. His cheeks are huge because mumps replicates in the parotid glands. Right, so that's why his face is looking all weird and large. It can also be found in the testes, which leads to orchitis due to inflammation of the epididymis. It is usually unilateral but can be bilateral. The orchitis is depicted by the single orchid in the flower pot that he's carrying, right there. Where was I? Sorry. Yeah. Another serious complication is meningitis. So he has a neck brace on, right? Every time we ever see a neck brace, meningitis. So mumps, we're seeing the orchitis, the parotid gland stuff, meningitis, right? The mummy is handling the tentacles, and the mummy child has sticky stuff on his hands. Plus, the mummy is carrying a scalpel from Paramyxoviruses. So mumps actually has all three things, right? So you can see the scalpel is on the plate right there. So he has the NA, which is the scalpel, HA, which is the octopus legs, and then F protein. All three things are there in mumps. The last thing is your respiratory syncytial virus, right? And we just talked about what syncytia means. Syncytia is a multinucleated giant cell or a Wharton-Finkelday cell. So RSV depleted by the RIP tombstone, right? But instead of RIP, it says RSV. And the 3 baby ghosts, because RSV is seen in infants less than 3 months of age. It attaches to the respiratory epithelial cells using G protein. So one baby is holding a G worm. So that's the right there, right? So this worm that he's holding looks like a G. He dug it out of the soil right there. Diseases it can cause include bronchiolitis, pneumonia, rhinitis, and pharyngitis. Most importantly, RSV is the most common cause of pneumonia and bronchiolitis in infants. Hence the bronchioles on their ghost sheet, right? So they all have their bronchioles kind of highlighted in the ghost covering that they're wearing. And not just newborns, but it also affects, more specifically, it affects premature infants. That's the big deal you need to remember for your step 1. RSV makes syncytia, which is what the S stands for. Hence, it must have F or fusion protein, so you have this kid with the sticky stuff. Ribavirin, a nucleotide analog medication we saw in biochemistry. Ribavirin is used to treat RSV in adults, but it's not recommended for kids or in pregnancy. Right? So it's for adults with respiratory syncytial virus. This is depicted by the ribs around the kids. Right? So ribavirin, the rib cage. Right? So it's a rib cage to keep all the kids in one place. But you can't give it to kids. Ribavirin is given to adults, so that's something you gotta make sure you remember. Palivizumab is used for prophylaxis in kids who are at high risk of RSV, especially premature babies. Hence, the pale baby is holding a rattle that resembles an IgG. So this one. So the pale for palivizumab, and it's a monoclonal antibody, so that's why his rattle looks like an IgG. That's really all there is to RSV. So RSV only has the F protein. No octopus, no scalpel. Lastly, the final thing we have is Parainfluenza virus, which causes croup, characterized by a seal bark cough and inspiratory stridor. Hence the seal barking outside with wolves. So that seal right there with 3 wolves, right, trying to blend in. They're all howling together, and that is supposed to remind you of seal bark cough. The wind is blowing into the church to depict inspiratory stridor. There are 3 wolves for all 3 virulence factors, HA, NA, and F. That's why there's 3 wolves. You don't see the scalpel or anything this time, but you just got to remember that just like mumps, parainfluenza also has all 3 things. The steeple of the church represents the characteristic steeple sign seen on chest x-ray. Right, so this thing. This is exactly what you see in a chest x-ray. Croup mainly affects children, but adults will get a severe cold. Right, so it can affect adults too. There it would just be causing a severe cold. So mumps, parotitis, orchitis, meningitis. The only thing that wasn't mentioned in Sketchy Micro is pancreatitis. So you have to remember that too. Right? And that's a little weird one, right? You have a viral infection here that's causing pancreatitis. You don't really get to see that with anything else per se. So it is pretty unique here. Can cause sterility, especially after puberty, because of the inflammation of the testes. So you got to deal with it. But more importantly than dealing with it is to make sure you get your child the MMR vaccination. Alright, so the last page here just has your rabies virus, Ebola virus, and Zika virus. The new guys that had just recently come up. And the only picture we haven't yet talked about is this picture right here, which is for your Bunyaviridae. Right, and then this is rabies, rhabdoviridae, arena virus with the 2 arena fighters, and then this is a goal for Ebola. Right, so I'm going to wrap all of those up in the next video, finish up your negative RNA viruses, and then jump into having a complete video where I really do a good deep discussion about understanding all 5 of the hepatitis viruses and how to really master remembering which one is which and what they cause. Alright, So thanks a lot for joining this time, and I'll see you guys later on.